county level, we need to form what you call the county technical working group in terms of population, so that we can look at our population. The population here is very youthful. Actually, 68% of the youth of the population in Garissa is youthful. Actually, they are less than 35 years old, from 10 to 35 years old. And what we need to do is we need to focus for these people, look employment for them, and draw up a lot of strategies in terms of what you call youth employment. That is the direction we should go. Here today, they are here tomorrow. And they need actually what you call a tailor-made specific development project. The government, both at the national level and at the county level, must come up with a Marshall development plan to help these people who are shifting from place to place. They should be able to dig dams, give them schools, and make sure that these people are actually catered for. And then the health follows it up, and every other thing follows it up. Focus on rural development. That is the direction we should go. The urban guy will always get services here and there. But we need to focus on that guy, the camel herder out there, the shoeless woman in Lagdera. These are the people we want to focus on and take development all the way to Mashinani. I'm sure the BBI is coming up. They are talking of ward development now. And that's, I think, the direction we should go. It was a very, very fruitful workshop. We were trying to look at advocacy and public engagement in terms of strategy among our population. How we are going to form what we call the technical working group in the county, so that National Council for Population and Development, we looked at health issues, we looked at nutrition level, we looked at the mortality rate. All these things were discussed today at a very, very big level. And so we did a lot of what you call public, we intend to do a lot of public engagement, and it was a very, very fruitful thing. We looked at issues of early marriages, we looked at what you call child mortality rate. So it was more or less health related and in terms of population, because a healthy population is a developed population. And that's the strategy they were using, ladies and gentlemen.
We are here in Garissa to disseminate various documents. And one of the 4 documents that were developed by NCPD include the advocacy and the public engagement strategy. We have the coordination strategy. We have also we have also developed a county demographic dividend guidelines that are supposed to give a pathway on how the counties are supposed to implement the demographic dividend component in the CIDPs, the county integrated development plans. And also part of the disseminations, we have also disseminated the Kenya 2018 Service Delivery Indicator survey. This is a survey that was undertaken last year in all the 47 counties, and we targeted over 3,000 health facilities where we visited. The essence of the survey actually was just to look at how prepared our country is in terms of provision of quality health, because health is very paramount with regard to affecting population. So various indicators have come out with regard to availability of vaccines. Indicators are in the report. The report is out. We launched last at national level, so we are now launching in the counties. And then we can see a lot of indicators coming in, and now we are going to the counties because they are the main people implementing, considering that the health is a devolved function. So indicators are coming out in terms of absenteeism among our health workers. We can see a lot of absenteeism, whether authorized or unauthorized. The indicators are in the report. With regard to diagnostic accuracy, whereby you can get health workers, they are able to diagnose certain health conditions, but not able to provide the right treatment. Also, the issue of stockhouse and stockhouse of family planning and maternal commodities. And also infrastructure in terms of how are we doing in terms of infrastructure availability. So all these things have been, the indicators and the findings are actually in the report.
As National Council for Population and Development, been developing various documents and also taking part in various surveys. And today it was a chance for Garissa County dissemination meeting whereby we invited leaders from various departments, line ministries, NGO representatives, private practitioners, civil society, religious organization. And the main purpose is we want them to understand exactly what National Council for Population and Development is doing as it implements the National Population Policy, commonly known as Session Paper number 2 of 2012. We have key areas, various issues that have come up that actually needs implementation so that we are able to actualize the population programs in this county. One of them is that participants are complaining that wherever such documents are being developed, they are not being involved. So they are of the view that wherever we develop a document, it is good at least it is brought on the ground for validation so that their views are captured. Another thing is also that it is as if they are not feeling the activeness of National Council for Population and Development, and it is because we take some time before we invite them for meeting. But here, a solution is there already because we have started the implementation of activities, and we shall ensure that we involve as many leaders as possible so that at the end of the day, the population programs that we are intending to run or that we have been running, they are owned and they feel part of those programs. And also there was an issue of developing some of these documents in the local vernacular, of which I see it as a working way forward, whereby if we can be able to mobilize local resources and develop such documents in the Somali language so that it's widely shared, I think we shall be making a step forward. And among many, they have also recommended that we need to be having such meetings so that at any given time, they are in a picture of what National Council for Population and Development is doing and what it is intending to do and what are the benefits the people of Garissa will get out of the council.